In a weekly press conference, Russell Myers, the CEO of Midland Memorial, said that a significant spike happened over the weekend at the hospital. COVID patients have jumped from just 7 to 25 in the last 2 weeks. Now, you need to know that number, it doesn't paint the full picture because not all of those patients live in Midland. Jonathan Polasek joins us now live to explain. Jonathan?
Good evening, Tatum. One of the things that we've seen is that local hospitals are getting quite a few of their patients from out in Lubbock. And as University Medical Center out in Lubbock told me, it's simply because they're almost at max capacity themselves. And as for the spike in COVID cases, well, hospitals are still trying to figure that one out. These days, our local hospitals are taking on a bigger workload, helping out our neighbors north of us. Midland Memorial has received 10 COVID patients from University Medical Center in Lubbock. With those incoming patients, Midland Memorial's overall COVID capacity is nearly 15%, and a recent spike is cause for concern.
We had a significant spike over this past weekend. As we understand that there has been some period through the weekend where hospitals in Lubbock were on diversion status, and so we've gotten more transfers, more patients moved to us than we're accustomed to. Of those 25 patients who are in the hospital now, 10 of them live outside of Midland County.
Over in Ector County, the story is no different.
Only 13 of the 29 are from Ector County, which means 16 of the 29 are either nursing home patients or out-of-county transfers. So that's roughly 55% of our COVID patients are not from Ector County.
Even with the transfers, Midland Memorial still has 25 COVID patients in-house.
At 25 patients, that's 13.8% of our total census. So we're just below the governor's threshold of 15%. But just over the past 3 days, we've seen quite a significant tick up in our patient volumes.
But the question remains, why are we seeing a significant jump in COVID cases these last couple days after a downward trend?
I'm not exactly sure why there would be a big jump. I don't think we've seen any, we haven't seen any holidays. We're well past Labor Day. It could be a number of things. Now, as far as the numbers, it had been taking a pretty good either flattened off or a slight dip over the past few weeks.
Now, I've reached out to both the cities of Midland and Odessa, as well as both of the counties, to figure out just how reaching or exceeding that 15% COVID patient threshold would impact the reopening of both areas, but nobody was available for comment today. Reporting live in Midland, Jonathan Polasek, News West 9.